Good morning, viewer. Welcome to our Force Active USA. Here is some breaking news. Why some people avoid COVID-19 when those around them have it? Study explains. The researchers zeroed in on the T cells according to the study published in Nature. They said that the T cells that they measured not only targeted the spike protein part of the virus but also the nucleocapsid, the core part of the virus. The Omicron variant of the coronavirus has led to a surge in COVID-19 infection across the globe. The heavily mutated strain is believed to bypass the existing vaccines and give stronger infection to the host. Yet there are some people who don't catch the virus despite living with a person who has COVID-19. How is it possible? A new study has explored this angle, claiming that such people may be exposed to other coronaviruses in the past that enabled them to make memory immune cells called T cells. They offer a higher protection against COVID-19. Cross-reactive immune responses to SARS-CoV-2 have been observed in the pre-pandemic cohorts and proposed to contribute to host protection, said the study published in Nature, which studied 52 COVID-19 household contacts to capture their immune responses. The idea was to capture immune responses at the earliest time points after exposure to SARS-CoV-2 virus. The researchers noted that viruses from the coronavirus family, though causes different illness, have some shared characteristics. Their shared structural similarities enable immune cells that recognize one type of coronavirus to recognize another type, said the study. The blood of all the 52 household contacts was tested between day 1 and day 6. The researchers found higher levels of memory T cells in the samples of those who tested negative on a PCR test for COVID-19 than those who tested positive. The T cells that they measured not only targeted the spike protein part of the virus but also the nucleocapsid, the core part of the virus that stores its genetic material, the researchers said. Meanwhile, an infectious disease expert had said earlier this week that vaccinated people and those who have not taken a jab experience different Omicron symptoms. There is little systematic data so far, but I expect that many vaccinated and especially boosted folks and experiencing very mild symptoms, and there is a high proportion of vaccinated folks who have no symptoms. Dr. Peter Chin Hong, an infectious disease specialist at the University of California, San Francisco, told to the reporter. Dr. Maya N. Clark, a professor at the New York University Mayor's College of Nursing, said vaccinated people are reporting headaches, body aches, and fever when infected with Omicron. Unvaccinated patients are more frequently reporting cough, shortness of breath, and flu-like symptoms, she added. Beyond the report, Force Active USA.